Dr. Donald Fennoy, Superintendent for Palm Beach County Schools, is joining us this morning to talk about the school year and how it's going so far from an administrator's perspective. Dr. Fennoy, thank you so much for taking the time with us.
Not a problem. Thank you for having me.
We're seeing COVID numbers rise around the country and here in our area as well. And some of the experts that we've been talking to have called it pandemic fatigue. People are getting sick of social distancing. They're sick of wearing masks, and they're not doing it as much. Are you seeing that from the students in some of your schools?
So no, actually, we haven't seen that inside the schools. You know, our principals and teachers and other administrators are just working really hard to not get complacent and hold firm to all of the COVID safety protocols that we put in place from the very beginning. We are seeing an uptick in cases, but we work directly with the health department here in the school district of Palm Beach County. And as of to date, most of those cases are happening outside of the schools and then brought into the school. So right now, we are able to maintain our 6 feet social distancing. In most cases, we have maybe 1 or 2 schools where there's a very large population and they're making those adjustments. But masks are still mandatory, hand washing, hand sanitizer stations, and a lot of cleaning is going on in our buildings right now.
You're talking about some of those large schools. One of those is Palm Beach Central High, and we've seen from the dashboard that that's a school that's had, I believe, 24 cases so far. When you see a school specifically that's having some problems with positive COVID tests, is there something specific you do?
Well, we do the contact tracing. We make sure that we over communicate with families about these realities. And we're sending out just lots of messages to families. If your child is sick, keep them home. And really, that's really what we're doing. But again, a school like Palm Beach Central, which typically would have close to 2,000 kids in it right now, we're hovering around 400 or 500. And they're spacing out and doing everything that we can. But I think a lot of what we're, again, determining our cases are coming from gatherings. I think to your opening statement, outside of school, people are just fatigued and doing it and trying, I guess, to move back to normal life. And unfortunately, it has a lot of consequences, especially because the majority of our cases are asymptomatic. It's just that when people get the test as part of the COVID tracing, it pops, positive, and then we have to adjust accordingly.
As you mentioned, a big part about keeping COVID out of our schools sort of falls on the parents, so, to make sure they keep their child home if they're feeling sick, or to notify the school district if they've had a positive test, if they've went and got a positive test with a doctor. Are parents doing a good job of doing that?
Oh, absolutely. Absolutely. Every weekend we get calls about positive cases, and, in some cases we can identify it down to because we have seating charts in our classrooms, do a lot of we have directional hallways, seating charts in cafeterias. So we're able to quickly identify other people that the students or even adults have been in contact with and quarantine them immediately. And so I think that's why up until this point, we haven't had to shut down or pivot to distance learning fully in a school yet.
We spoke on the first day of back in-person school, and one thing you weren't worried about at all was having enough PPE. Are we still in a good spot with having enough PPE for our schools?
Absolutely. So between the school board investing significant dollars, obviously money from things from the state and some federal dollars around this, we've been able to supply. I think in the beginning, especially this summer, we have to remember, now we have, a little bit of a pause to kind of reflect. You had the entire world ordering at one time. That was the original challenge. Was the supply chain was not prepared to deal with sort of the influx of the requests. But since then, we were very lucky in the beginning. We were able to warehouse a lot of things. We ordered some things back in April, and then lots of donations. Let me be clear. This is one of the benefits of living in such a wonderful community like Palm Beach County. A lot of local businesses stepped up and donated masks and hand sanitizer. I cannot thank the county enough for going in their warehouses and also helping us out. So we are fully stocked. And then other things that we ordered earlier, like the anti-static machines, the Clorox machines, the misters that you've seen. So a lot more of those will come in, and we now have those in every school.
And now you are bringing in rapid tests as well, starting after Thanksgiving. Can you explain sort of how big of an undertaking this is and how this changes the process after you have someone who's showing symptoms in your schools?
Well, so the tests are actually coming from the state. And we're again very fortunate here in Palm Beach County to have the healthcare district and the health department. We have school nurses in almost all of our schools, and so they have been trained on how to deliver this particular test. And again, it's for only symptomatic people, so adults and children in our building. And then we will continue with that testing as long as the supply keeps up from the state. So as of right now, we have almost 9,000 tests. Again, but if a child is experiencing symptoms, the first course of action is for families to keep them at home. But if those symptoms reveal themselves in the building, we have the ability now to test through the tests provided by the state. And then we would encourage families to govern themselves accordingly after those tests come back positive if they do. And even if they come back negative, I think it's still an opportunity to keep a child at home if they're sick, and then maybe test them later to see if the symptoms manifest themselves at a later date.
But if you have someone who tests positive, let's say it's a student, and another student has had mask-less contact with them and they're worried about possibly being asymptomatic, they can't go to the school nurse and get a rapid test.
As of right now, this would only be for symptomatic children and adults.
Okay. Rapid tests they haven't proven to be as dependable as other tests. So do you still feel like this is going to be an important part of how the district tackles COVID-19?
Absolutely. Any testing right now is better than not having testing at all. And again, Dr. Elena Alonso and the health department and the healthcare district, since they're part of the team that is training and then actually helping doing most of the contact tracing and we're assisting actually them. If they say this is a good start, then we will fully support it. Because at the end of the day, I think what we have to be clear, this will help start to eliminate or at least alleviate some of the anxiety and stress. So I think having some quick information around whether or not a child or an adult is sick with COVID, again, no, I don't think they're 100% positive, but again, I think the data that they showed us is that it's in the 90s. But we would still encourage people to do what they need to do personally if those tests come back positive.
We talk a lot about you said anxiety and stress that the students, parents at home, teachers in class, are going through all this. But you also brought up, now school nurses have had to go through this extra training. What else is being given to our nurses to help what must be a very stressful time?
Well, just a lot of support. I mean, again, we've created, not only do they have their own personal spaces and offices, but we have other sort of quarantine rooms that we've created. A lot of, we're not allowing, people into our buildings unless you're an employee or a student, but partitions and again, all the PPE that they want and need. And then again, they can kind of set their own rules around how people enter their spaces as well. And so we listen to them as healthcare professionals in our buildings, and we really try to hold very, tight protocols and procedures. And so again, but constant communication and training around the things that they see we need to do, and we're making adjustments if those recommendations are something that we all can agree to.
Here we are in the middle of November, and the governor has still not announced whether or not students in Florida are going to be able to stay home starting in January. First off, has the state given you any guidance about what's going to happen in January? And secondly, if not, are you preparing now for the possibility that all kids are going to have to go back to school?
So we have not received any indication. However, we have received an invitation to have a conversation around the second semester, especially as it relates to Palm Beach County, Broward County, and Dade County. So the three superintendents and our teams are working with the commissioner. We actually have a meeting with him in the next couple of weeks to discuss sort of the different realities. I mean, it's clear to everyone in the state of Florida that the three of us had to start later because it's the significant amount of COVID cases that were in South Florida, which delayed our start. And so, one of the things that the governor and the commissioner allowed was parents to have a choice. And so we all created, an opportunity for parents to have a choice. And so in our particular context, we have about 40% of our families that are coming in brick and mortar. And the other 60%, again, that's a rough estimate, who are still in distance learning. And those parents have made those choices. I think I've said in other media outlets that in my home, I've made both choices. My oldest child, who's in middle school, he has been back in brick and mortar since the day that we opened. But we, as a family, decided to send my kindergartner to school this year because we just didn't think she was ready to adhere to all the protocols and procedures. And so I think what that would be my ask of the governor is to allow our families to still have those choices. But to your question, if for whatever reason a new executive order doesn't come in, or the current executive order isn't extended, we're preparing for that reality. However, we're lobbying a lot harder to allow us to stay in our current mode of operation, which is giving families a choice.
So just so I understand the technicalities of this, so for kids to be able to stay home and have that opportunity, then this executive order is going to have to be extended. If the governor does nothing, then all kids are going to have to come back to school.
That would be the way the law would be written, yes.
Okay. As we said, I've talked to some parents and some teachers, and they've sent me some questions. One question that we got from parents is that they're still seeing some issues with buses. Sometimes wait times are different, or it's a different bus coming to pick up their kids. What are being done right now to solve busing issues?
Well, it's a challenge because bus drivers are humans as well, and they are getting sick and quarantining based on different circumstances. So a lot of if there are delays, it's because either we don't have enough drivers on that day, or we're adjusting routes based on an outbreak from the week before or day before. So it's a moving target. And so we're doing our best. Our enrollment on the buses is down significantly, and we're also trying to make sure that the bus rides are very safe. In addition, this year, in order to help with contact tracing, children must register to be on the bus. And so as more registrants come in, then we have to adjust the routes to maybe pick up those kids. So again, definitely not an ideal situation, but I think with COVID, we're being very cautious with all of our employees. And if they have to quarantine based on some factors with contact tracing, we have to do that. And so again, I know it's not ideal for parents, but they are doing the absolute best that they can.
We spoke to teachers that, some of them that were teaching from home and thought that was going very well. Others that were teaching in class and thought that was doing well. But pretty much across the board, the ones that thought that they were struggling were ones that were doing both at the same time. We're having to teach, kids in class and teach remotely at the same time. Is there anything being done to get rid of that as much as possible so that it's either all virtual or all brick and mortar students per class?
No, we're not in the mode of trying to get rid of it. It is literally what we're seeing on the ground is that people are getting accustomed to it every day. You have to remember, no one had done this before. So it was very challenging. And now we're almost 9 weeks in actually. And so we're seeing increased levels of fidelity with that process. I think, as the year goes by, we would definitely find ourselves in a situation where applicable, we would let people just teach distance and let people teach brick and mortar. But right now, because we could have almost, there could be significant numbers of teachers who are quarantined. So I need them to teach at home while they're there. And then we have other people teaching the kids in class. So it is still a moving target because people are coming in and out of the buildings based on COVID. So this mode, like my oldest child is in person, but there are some teachers that teach at home. But when I visit classrooms, and I've visited almost 60 schools since we opened up, more and more teachers are actually getting great at this, to be honest with you. You can walk into a classroom and then you'll hear a child on the speakers who's at home participating in the same way. And so again, this was something none of us had done before. And so we're just getting better and better at it every day. And truthfully, there isn't a school district in the country that isn't experimenting with simultaneous teaching. But again, I recognize that it is not ideal, but I think the longer we participated and we fine tune the process, the better we would become at it. But, I think all of our hope is at some point, all of our children can be back in schools and we just have a regular school setting. But I want to be very clear. I think this distance learning model has changed public education forever, and I don't think it'll ever go away.
So you think in the future, kids are going to have the option about whether or not they want to learn virtually or go back to brick and mortar schools?
I think the community will drive that. I mean, we're seeing originally when we first started back in May, and I told the team to design the distance learning platform. It was with this idea that if you and I get into a fight at school and we get suspended, prior to COVID, you would just go home, and if your parents had the wherewithal or desire to go to the school to get your missing work, you could get it then. Well, now I can just assign you to a distance classroom, and so you don't have to miss as much instruction. I think in our alternative spaces, sometimes it is difficult to find teachers who are willing to work in those spaces. And so now we can have kids have access to great teachers through this distance learning platform. Another thing that's become a reality for us is our high school students. A lot of our high school students made the decision, and it's a very logical decision. Do I get up at 6 o'clock in the morning to try to get to school where, I can't hang out at the locker, everyone's telling me which direction to go, or do I wake up at 7:15 and just log into my class? Many high school students are just choosing to stay distance learning, and they're becoming very accustomed to sort of the Google Classroom setting. And then you can see that transition because the universities, very few kids have been in-person class at the university setting. So honestly, I think it's going to become a new norm. Again, I think we call it the forced innovation of COVID. And so I just don't think, and then let's be clear just on the dollars and cents aspect. We've invested probably just in our district alone, hundreds of millions of dollars in distance learning, to include upgrading our infrastructure, buying laptops, Wi-Fi, getting our families who maybe couldn't afford Wi-Fi connected. I doubt seriously we're going to undo that entire infrastructure once we get past COVID.
We had a student roundtable rather, where we brought some kids together, and there was a AP student from Atlantic High who said, yeah, this is a lot better for me. I'm not, having to bring packets all around. I can just click on a link and there's all the information I need. So yeah, he agrees with you. This is something that is better for him. But would you agree that going forward, sort of virtual learning, if they are going to do that, it's for either the top level kids, or like you said, whether or not there's something that's physically keeping a kid from coming to school. Still, those kids that are younger and maybe need more structure in their lives, brick and mortar schools are probably still what's best?
Oh, that is absolutely what's best. I would not disagree with that. But I contend that even when we get back to brick and mortar fully, there will be a digital element. Put it like this. It is unique for me to be a father of young children and be a superintendent of such a large system. My son hasn't done a worksheet. Now, remember when we were in school, people would hand us copy papers all the time. That's not the reality anymore. All of his assignments are in a Google Classroom. As a family, my son can no longer, I won't say lie, but tell me he's done his homework, because I can just log onto the computer and see all of his assignments. I can see due dates. I can see when he turned it in. This new way of monitoring your child's progress is pretty significant. And I think for teachers, I'll give you an anecdote. I was picking my son up from school one day, and I said, well, how was school today? He said, well, I had a test in science. And I said, as a lifelong educator, when are you going to get your scores back? And he said to me, I already got them, Daddy. What are you talking about? As soon as I got finished, the score popped up. Because now these assessments are put into systems that grade instantly. And so think about that change. As a teacher, I remember taking a bunch of papers home with my red marker and going through it. Well, those days can be gone in the near future.
Last question. The one frustration that the teachers felt more than anything was that a lot of times they felt like they were getting information last minute about whether or not kids were coming in class, or they were changing class, or they were losing students. And they wanted me to take that concern, to you. Is there anything that can be done to try to keep teachers more in the loop about the big things that are going on in their classrooms?
Yeah, one of the first steps we did, we've been in a straight development stage since March 13th. But now that things have kind of calmed down and we're shifting in quarters, we're getting ready to go into the holidays. One of the things that we did is we asked parents to make a choice, about several weeks ago to the remainder of the semester. And then we will ask parents again for the second semester to kind of lock in their choice. Our initial plan was to allow parents to kind of move in and out. Well, that became very disruptive. And I think parents took way too much advantage of that. And so Well, we realized getting the feedback from our teachers and principals that we needed to stabilize enrollments so that we could create, we ultimately created over 500 plus, almost 600 virtual teaching options. So there are about that many teachers who are teaching at home exclusively. But we did recognize that, and so we hopefully now the stabilization, which occurred officially on the 4th of November, will allow us to not have that same movement in and out. Now, COVID cases, that is a completely different situation, because if once a child or a teacher has been identified as been in the exposed or has been tested positive, we still have to move them in and out. But I think as we become more comfortable with our systems, our protocols, we are getting that information out faster than we once were.
Dr. Donald Fennoy, thank you so much for your time. Good luck the rest of the semester and the rest of the school year.
Thank you, sir, for your time. I appreciate it.